Lacosamide is used to prevent and control seizures. It is an anticonvulsant or antiepileptic drug. It works by reducing the spread of seizure activity in the brain. How to use? The initial dose is 50 mg twice daily. Depending on response and tolerability, the dose may be increased at weekly intervals by 100 mg to divided doses, up to 400 mg daily. Oral tablets may be taken without regard to meals. No dose adjustment is necessary for patients with mild to moderate renal impairment. For patients with impaired hepatic function, titration should be done with caution, and the daily dose should not exceed 300 mg in patients with mild or moderate hepatic impairment. Precautions. Antiepileptic drugs, including lacosamide, increase the risk of suicidal thoughts or behavior in patients taking these drugs for any indication. Patients treated with any antiepileptic drug for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Lacosamide may cause dizziness and ataxia in adults and pediatric patients. Do not take other medicines unless they have been discussed with your doctor. This includes prescription or non-prescription medicines and herbal or vitamin supplements. Side effects. Along with its needed effects, a medicine may cause some unwanted effects. Although not all of these side effects may occur. If they do occur, they may need medical attention. More common: dizziness, false or unusual sense of well-being, shakiness and unsteady walk, sleepiness or unusual drowsiness, trembling or shaking of the hands or feet, unsteadiness, trembling or other problems with muscle control or coordination. Less common: being forgetful, discouragement, feeling sad or empty, irritability, itching skin, lack of appetite, loss of balance control, loss of interest or pleasure, motor or mental changes, tearing of the skin, tiredness, trouble concentration, trouble with sleeping, trouble with walking.